Hello, guys, it's TGIF. I hope you've had a nice week so far. I want to thank you for listening to the first episode and for your feedbacks and reviews. I see you and I love you all. It really makes me happy to see your comments, especially, and I promise you that it will only get better as we progress on this show. If you haven't listened to the first episode, please do so and leave your comments as well. Your feedbacks will mean a lot in improving the show. I welcome you to the second episode of the Anti-Pharmacist podcast. So, let's get right into it. Before I begin the episode proper, let me mention that this particular topic is for mature minds. So, you might want your younger ones to sit this one out. Like I mentioned in my introductory episode, this podcast is about pertinent issues, and based on what I have experienced in practice, I believe this topic is worth discussing at this time. Having said that, today I'll be talking to you about birth control. Yes, that's what I said, birth control. But I'll be focusing on the emergency contraceptive pills, otherwise known as morning after pills or ECPs for short. There are three major drugs used as ECPs. They are ulipristal acetate, levonorgestrel, and combined oral contraceptives that contain estrogens and progestins. In Nigeria, levonorgestrel is the readily available ECP, so my discussion will be based on this. It is known by several brand names like Postinor, Postpil, Backup, and the likes. It is packaged as either a 1.5mg tablet or 0.75mg tablet. It has come to my notice that morning after pills are one of the fastest selling medications in pharmacies, especially during the rainy seasons. Don't ask me why, because I don't know. I have also noticed a recent trend that more men now come to get these morning after pills, unlike before, in which only women come to get them. Then, I start to wonder what is happening. Is it that culture has shifted and people are more woke, such that men do not see it as a big deal to get it, or something only women should get? While this is a welcome development, I just hope that some of these men are not using the pills for themselves. Don't be shocked by my statement though. I have my reason for saying that. So there's this scenario that happened and a colleague of mine shared with me, in which a man actually came into the pharmacy to get a morning after pill. He also bought bottled water and stepped out of the pharmacy. Just outside the pharmacy, he opened his bottled water and popped this pill. To my colleague's utter shock. Imagine a man taking a morning after pill. This got me wondering why he would do that. Then it occurred to me that it must be as a result of misinformation. He might have just heard it from the wrong person that it served a purpose for men. But my people, morning after pills are used by women to prevent pregnancy, and they are not for men at all. I'm aware that some people erroneously believe that they can be used to prevent sexually transmitted infection. This is so not true. They do not prevent infections at all. What they prevent is pregnancy. In order to prevent STIs, you have to use the barrier method of contraception, which are the condoms. Emergency contraceptive pills, which I'll be calling ECPs from now on, are hormonal drugs. They work by preventing or delaying ovulation, which leads to pregnancy. I will do a brief explanation of the mechanism of action, which is called the negative feedback mechanism. These hormones are designed to mimic naturally produced hormones in the body, so they are called analogs. In the case of levonorgestrel, which is a synthetic progestin, it prevents the release of progesterone from the adrenal cortex, where it is produced in the body. The function of progesterone is to trigger the pituitary gland, also known as the master gland, from releasing a couple of hormones needed for ovulation. That is the release of eggs, which leads to menstruation or pregnancy, in the absence or presence of fertilization, as the case may be. I hope I have not lost you. So in summary, the presence of ECPs in the body causes progesterone to lose its function, thereby delaying ovulation. This happens with other types of oral contraceptives, which is why some women who use them do not see their periods. Now, I will explain how to use these ECPs. They are to be used within 72 hours of unprotected sexual intercourse, not after 72 hours, and not at 72 hours. They must be used before the end of 72 hours, that is, 3 days, before the end of 3 days after the act. Some people come in asking for several packs of these ECPs, but as a rule, I don't dispense more than 2 at once because they actually should not be used more than once in a cycle. Besides, they are not daily contraceptive pills, but rather are for emergency cases. Emphasis on emergency. A woman might have just met with her partner outside her safe period and doesn't want to take the risk of getting pregnant. This is the purpose for this pill. They are not to be taken every day or multiple times within a single cycle. So when a man or woman demands for several packs, I take it upon myself to explain to them why I can't dispense it to them, because there's a possibility that they might be tempted to abuse it since it's readily available to them. I also make sure that they know how to use it by furtively asking if they would mind me explaining its usage to them. The 0.75 mg tablet pack differs from the 1.5 mg tablet in the sense that it contains 2 tablets which are to be taken at 12 hours interval. I get that some may still be shy and may not want to engage in any discussion on the ECP, but want to get it and get out as fast as possible, especially in a busy pharmacy. But there are subtle ways to pass this information across without making them feel embarrassed, and pharmacists know this. It is better to get instructions directly from the pharmacist than to get home and start reading leaflets and package inserts that they may not totally understand. There are many negative effects of misuse or abuse of ECPs. A common one is menstrual irregularities. It could even cause infertility. Remember the negative feedback mechanism I explained earlier? Constant supply of synthetic progestin may cause the body to stop producing progesterone altogether, or may cause it to be produced at suboptimal quantities. Therefore, the normal function of the progesterone is impaired, and issues like ectopic pregnancies and miscarriages start occurring. Instead of using ECPs every time you have unprotected sexual intercourse, you can opt for other methods of contraception like the daily oral contraceptive pills, implants, depot injections, patches, or intrauterine devices called IUDs. You can visit a family planning clinic where nurses who are knowledgeable in this matter will help you choose an appropriate one for you. If as a woman you are experiencing any discomfort or side effects like headache, weight gain, bloating, increased blood pressure, and the likes, with your usual method of contraception, you can switch to another with the help of these healthcare professionals, and I'm sure you will definitely find one that suits you. Or you could just stick to the barrier method, which is the use of condoms. Both male and female condoms are available. But for women whose partners are not amenable to using the barrier method all the time, they could decide to practice the good old safe period method. There are lots of applications that can help you track your menstrual cycle and notify you if you're ovulating or not, so that you can abstain during your ovulation period and be free to engage during the safe period. Although you will still be taking a risk because this method is not guaranteed. Another less popular method is the spermicidal cream, which kills spermatozoa. All these can be used regularly to prevent pregnancies, while the ECPs are to be used once in a while, not even every month, because they deliver a high dose of hormones at once, unlike others that release them in small quantity over a period of time. Now, I think it's important that I talk about drug-drug interactions with ECPs. That is, medications that should not be taken while on ECPs or used concurrently with them. These medications may reduce its absorption or hasten its excretion from the body, causing it to be ineffective. If you combine your ECPs with these medications, there is a high probability that you will get pregnant. Examples of such are retinoic acid derivatives like retin A, popularly used in the treatment of acne, artemether, which is an anti-malaria, griseofulvin, an antifungal, rifampicin, an antibiotic used majorly to treat tuberculosis, antiviral medications like nevirapine and lopinavir, anti-diabetic and anti-seizure medications. There are lots more. I know I have mentioned a lot of aunties, and aunties, but not to worry. You don't have to bring your jota out for this one. You can always talk to your pharmacist about any medication you are taking when you go get your ECPs. They are sure to guide you appropriately. You might have to take a double dose of the ECPs or use another method of contraception entirely. Also, weight has a role to play in the efficacy of ECPs. If your body mass index is in the obese range, ECPs may be ineffective for you. I've covered a lot of ground, right? Let me do a quick recap of all I have talked about so far. I've introduced you to the emergency oral contraceptive pills and their contents, how they elicit their action, their appropriate dosage and usage, how not to use them, side effects of misuse or abuse, other methods of contraception that you can use to supplement your ECPs, and finally, their drug interactions. Researches are still ongoing as regards the production and release of the male contraceptive pills, and as a researcher and healthcare professional, I'm looking forward to it, as I'm sure a lot of women are. This will ensure that responsibility for contraception is not borne by the female alone and is at least shared. And some of these side effects that women experience with contraception will be a thing of the past, or at least they will be greatly reduced. Of course, there's vasectomy for males. But how many men are willing to go under the knife? They would rather stick to the barrier method or keep coming to get money after pills for their women, which is totally fine, as long as they are being used right. And that's all I have for you on today's show. I hope I have been able to educate you concerning your emergency contraceptive pills, and you've gained something from today's podcast. Thank you for listening. Send me feedbacks and drop your comments or questions in the Q&A section under this episode, or send an email via antipharmacistpodcast@gmail.com. I would love to have them. Remember, your body is your only true home. You have the responsibility to take proper care of it so that it can serve you longer. Till next time, stay healthy and God bless you.